Williamsburg was experiencing things very similar to other colonies, and really all over the British Atlantic world. There wasn't a real way to treat. Biggest thing was trying to keep people safe, but the thing is you had to have someone who wanted to keep you safe. If not, you may end up in jail for a crime, or even because of your behavior. You're at the mercy of family members or friends to take care of you. So what Williamsburg is doing, really through the Burgesses in Williamsburg, what they're really doing is they're creating something that's going to create a safety net for so many different people who ran the risk of homelessness and abuse.
The king's representative here in Virginia in the 1760s was a guy named Francis Fauquier. It was his idea. The House of Burgesses, that part of our elected government here in Virginia, they agreed with the idea, and once he presented it, they moved forward with building a public hospital. It took them a few years to get to the point of building, but I think it just happened to be the right place at the right time.
It's clear that Virginia was experiencing a lot of precarity in the period immediately leading up to 1773, 1769 even with its charter. Especially coming out of the French and Indian War, the 7 Years' War, there was a lot of economic precarity, a lot of paranoia, a lot of fear, and you see an uptick in the newspapers with acts of violence being depicted.
In 1769, in the summer, there is a little article in the newspaper about a woman named Margaret Thompson killing her husband. And at the end of this editorial, it talks about how if there had been a house for her to care for her in her loss of reason, then Mr. Thompson wouldn't have died. The goal for the hospital was to take in any patients that they believed they could cure. So if they believed you were suffering mental illness and you could be cured, then you could be a patient here. But it was also a place to collect any persons who were a danger to society because they were suffering mental illness. So it was twofold. We're going to collect you and cure you, or we're going to protect the rest of society from you.
Nathan Phillips is an individual about whom I have been able to compile the most research with reference to the early patients. And he first appears in the Virginia Gazette in November 1772, having murdered an overseer. The Virginia Gazette said that he had been disordered in his mind for some time prior. Evidently something had happened either at a certain moment or over the course of a couple months, a couple years, who knows, that had caused him to kind of have that moment where he actually committed that murder and thus entered the historical record.
The stories of individual patients give us a great opportunity to put pieces together that we may never get to do. So the history of these patients, the history of mental illness also becomes the history of legislation and law. It becomes the history of medicine. It becomes cultural and social history. And when we put all those pieces together in a very unique way, because these are people who are in some way, are marginalized, we get to learn all kinds of new things that we didn't have access to.
We know a lot about Nathan Phillips after his case went to trial. He was in the Williamsburg jail for just over a year before being sent back to Hanover County to go through the process for actually getting admitted into the public hospital. In all likelihood, he would have experienced, at the very least, a calm, dry room with food being provided and with dedicated medical and non-medical care. That's kind of the main draw, I think, of the public hospital in that period, is it would have been a place where someone could go to actually get that momentum going towards treating what they saw as an acute crisis.
The community is working together to run and maintain and operate this facility. Everybody from the royal governor to the House of Burgesses to appointed court of directors, men who are serving to administrate the hospital here, to staff like a keeper and a matron from the community, enslaved members of the community, all the tradesmen and women who are working to furnish the public hospital, right down to all the shopkeepers who are providing the necessities needed to run a hospital of this size and this operation. Even though there may be only 6 or 7 patients here at any given time, that's still a large number of people to run an operation like this.
They provided something that when we look at them now, looks draconian and terrible. They're put into cells. They're there all day. They're there by themselves. But this is a huge improvement from wandering the countryside, being locked up in a jail with no kind of treatment. The fact that they have food and shelter and clothing doesn't strike us as all that impressive, but this was something that was really lacking before the public hospital.
It's not clear exactly how he was being treated because a lot of medical mental health care overlapped with anti-inflammatory physical medical care. And so although we do have names of medications or types of medications, it's hard to tell whether those are treating mental illness symptoms or whether he caught some kind of fever and was being treated for that. We do know, however, that he was being treated, and that marks a step in potentially a positive direction for him, as at the very least attention was being paid to his mental state in a way where they were trying to get him restored to what they call reason.
So we have the revolution, that's the part everybody knows. We have the public hospital, which is the part no one's ever really thought of. And this process demonstrates that Williamsburg is sort of a revolutionary place in terms of the treatment of the mentally ill.
In this colony, we're acknowledging that mental health care is a necessity. It's something that we as a community should be offering to our fellow citizens. And what an amazing thing that is.